It's hard to imagine a more appropriate setting for getting well and staying healthy than the Napa Valley in Northern California. On a mountainside overlooking the valley is St. Helena Hospital and Health Center, operated by the Seventh-day Adventist Church. Long a leader in lifestyle-oriented health plans, it's the home of the McDougal program, a diet-centered approach to health conditioning directed by Dr. John Mcdougall. The program balances lecture sessions with nutritious meals and exercise. Steve Wynn investigates.
I've never felt better in my life. Before I came to this program, I could hardly walk from the kitchen to the front room. But since being on this program for about 8 days, I feel like a new person.
I would recommend this program to any of my friends.
I really enjoyed the people that were there in the program, the staff of the St. Helena Center.
Dr. Mcdougall gives personal attention to each program participant, pointing out the signs of progress as his lifestyle plan begins to bring results. We wondered how he first came to focus so strongly on the role of nutrition in good health.
A young man walked into my office and he said to me, "Dr. Mcdougall, do you think diet has anything to do with the illnesses of your patients?" Oh, I said, "Absolutely not." And he said, "Well, how come you're so sure?" And I said, "Well, look, I went to one of the best medical schools in the country." And I said, if it was important, they would have talked about it. And I said, they didn't mention it. So everybody who walked in the office, I would say, "What do you eat?" You know, ask them how they live, you know, and check their health over and so on. And I was in a very, very unique situation. I probably couldn't have duplicated this experience in any place else in the world.
In his practice on a large plantation in Hawaii, Dr. Mcdougall witnessed the lifestyle contrast between different cultures and age groups. The insights he gained there helped to inspire his 2 books as well as the Mcdougall program.
And what I saw were the first generation who stayed on a diet of rice and vegetables, no medications. They could see perfectly, they could hear perfectly. Trim, healthy, hard-working people into their 70s and 80s and sometimes 90s. Their kids were fat, they had the gout, the diabetes, the blood pressure, the heart disease, the cancers, and so on that I had learned in medical school. So that gave me the first indication that disease is really not primarily an inherited thing.
Members of the hospital staff provide specialized assistance to Dr. Mcdougall. Terrence HANSON, Vice President for Health Programs, explains why this program is so welcome at the Health Center.
The Mcdougall program fits very well with us philosophically in the services that it offers, and it indeed expands some of the people that we can help.
The Mcdougall program is a lifestyle change program. It's a 12-day program. The people come here and stay. They live in the health center. They're taught a diet that's starch-based, high complex carbohydrate diet. They exercise, they have group therapy, they interact with each other, and have a good time. But the key thing is changing their lifestyle, and we give them the support to do that. They do have a full-service acute hospital here, but the hospital administration is also committed to prevention. Surgery is just a Band-Aid. It takes care of the person now, buys a little time. But if they don't change their lifestyle, they end up right back on the operating table.
The message that I try and get people to think of in terms of properly nourishing themselves is that there is a diet that best supports human health. And that diet is centered around starch, like rice or potatoes, sweet potatoes, corn, taro, with vegetables and fruits. And then there's another category of foods called delicacies, which are the candy bars and the cakes and the chickens and the fishes and so on. If you think about it for a minute, that's the way it used to be. Mm-hmm. And you feast on occasion if you're in good health. But if you're in trouble because you've been feasting 21 times a week for most of your life, then you need to stop feasting for a while to get your health back.
Herb and Jerry Harrison are recent graduates of the Mcdougall program.
I think I noticed a change after about 4 days, and the principal thing was I had stopped taking all my pills by the 3rd day, and the 4th day I felt just as good as when I was taking the pills, maybe even a little bit better. I have a greater outlook. I think my disposition's always been great, but I feel better anyway about it. Looking forward to the next day, and not necessarily the next meal, but the next day.
I think one of the good things about the Mcdougall program that a lot of, and this is a lifestyle, this is not a diet, but when people start losing weight and start and tendency towards dieting on this, that, you're given different quantities that you must weigh or you must count or you must, do something like this. And with this, you just eat, the quantity of food that you want of any particular food. And that's different and still losing weight, so that's a plus.
A demonstration that I like to give people is to show them these glass stomachs. And these stomachs are representations of what the actual stomach looks like as far as size. And each of the stomachs contains 500 calories worth of food. Now you're trying to fill the stomach up. If you have 500 calories worth of salad dressing, it's just a little puddle in the bottom of the stomach, and it doesn't fill anyone up. 500 calories worth of meat or cheese, likewise, is hardly any filling at all for that stomach. Whereas when you get into rice and corn and potatoes, they really start to fill the stomach up when you put in 400 to 500 calories of these foods, and that's what you're looking for.
And one of the questions that comes up is...
Dr. McDougall offers solid evidence to support his approach to total wellness.
It's a diet that's described in the Bible, and actually the medical treatment I use is clearly laid out in the first chapter of Daniel, when Daniel took his men who were living in the king's care, and he said to the gatekeeper, he said, let's do an experiment. Very scientific. Let's do an experiment. Let's take these men who are living under the king's roof, eating the rich foods, and let's put them on pulses and water, which are vegetable and water. They agreed. 10 days later, they evaluated their experiment, and their complexions were clear and their health was returned once they gave up the rich food. 2,500 years ago, people made that observation. It's as true today as it was then. And you know something? In about 10 days, we get almost everybody off of blood pressure pills, diabetic medications, heart medications, and they've lost a considerable amount of weight in that period of time. I suppose I should just give Daniel the credit, right?